Hi guys, welcome to my vlog. Today's vlog is going to be all about the vaccination that has to be taken in the first month. So yes guys, this is the chart that I had for my son where everything has been recorded. It has the immunization schedule. All the vaccines that has to be covered each and every month or the week wise will be documented over here. And apart from that is the growth record. As you guys can see, this is a growth record from the day he was born until now. So yes guys, I feel this is very important because you can track down like how the growth for your child is. So as you guys can also do this, but I am not sure if this will be available in government hospital. I have opted for a private sector. That was me and my husband, we decided for that because I got to know that there are some vaccines which are not available in government. So I don't want to miss out on that. I know vaccines are very important, so it's always good to go for a private sector if you want all the vaccines to be covered up for your child. But yes, even government sectors does have vaccines, important vaccines, but the ones which are not available, you guys can always go for a private sector and get it done. So the only difference will be that the government sector, the vaccines are actually free, and the private sector, it will cost you. And yes, vaccines, some of the vaccines are expensive as in it could reach up to maybe 10k max. Yes, 10k max as of now. It will be within 10k, you can expect that. So yes guys, the first most important two vaccines that has to be given immediately after the child is born, that is BCG, that prevents the child from tuberculosis. It costed us around 1200. Then we have as HepB2. It will prevent a child from hepatitis B virus. And apart from that was OPVO, that is a oral polio vaccine. It will help a child from polio. So these were the three important vaccines, and HepB2 costed us around 800 and the OPVO costed us around 400. These vaccines are very important guys. This has to be given immediately after a child is born, and I remember my child was born on 26th of December and this vaccine was given to him on 27th of December. So yes guys, please make sure that you don't miss out on these vaccines. These are very important. Please ensure that you get these vaccines done for your child. Also document something like this. It is very important and it's really good because you can see the growth of a child. It will see that the head circumferences, and then weight, and then you see the length. It will document everything. So in private sector, usually the doctor will check all of this. I'm not sure how it is in government. I haven't visited government except the normal polio drops that they give. I have only visited recently for the polio drops, and apart from that I have no idea about government hospital. But yeah, private hospital, they do check all of this. And why private hospital, I mean the private clinic I opted for is because I had a lot of questions, and I always prefer that I ask question and I get my doubts clarified, and I know I just want to be updated, I just want to know the things and prior before getting into it. Because as I told you guys, at my pregnancy journey, it was a bit of hassle and a lot of ups and downs, and I went through a lot of what you call the pain and all. So I didn't wanted all of that for my son, so I just kept digging things and I just kept checking out even the vaccines also, what vaccine is going to be induced to my child. I wanted to check that, and the injection size, and will it hurt. and what will happen, if will my child have a fever, or how it's going to be, everything I wanted to check. So I remember the first month, the vaccine that was given on 27th after his birth, I did not see anything like fever or something, but other vaccines, yes, I did see fever. So I will going forward, I mean in the next videos and all, I will share you like which vaccine, like what happens, and if my child felt sick and for how many days, and what doctor asked me to do in that particular period. I will surely tell that. And honestly guys, by God's grace, I mean I haven't seen my child falling sick a lot. I mean hardly I've seen him falling sick, and even me actually for that matter, I haven't felt sick like in a year, maybe once, but not a lot. Like really we don't fall sick a lot. And I would say that that is also for the intake that we eat. I mean we eat very not very healthy, I mean, but yes, we do eat healthy. We try and avoid any bad food, like oily, let it be bakery items and sugar, sweets and all. For my child, completely no sugar and no maida. But now since he's completed his 2 years is when actually he did taste cake. So yes, and of course he loved it. But yes, I avoid sugar for him. All this will be, I'll cover up all this. He also has his own channel where I post for the kids, especially about the food, like what you can give it to a child, because that is what I gave my child. And you can, and he's really healthy and rarely falls sick. So for his height, weight and all, he's really good. I mean doctor did say me that he's in a good shape, his height is good, his growth is really good, and he is super intelligent, very smart and very attentive, and he wants to explore a lot, which is a very good sign. So that's what it is. And yes guys, so apart from that, I would like to say the first month, yes, for the first month, I mean a baby will in the first 2 weeks is what I know, that baby will not be able to see a lot. I mean it will not be clear. The first week actually, it will be, the first day will be like very minimal is what they can see. Then the second day, it will, the sighting will increase gradually, and after fourth or fifth day is when they can start seeing clearly, guys. So that is how it is. And yes, you will not see much of the facial experience in the first month and all. It is very bare minimal. And apart from that, if you see, and they will not move much also. Yes, there won't be much of the movements and all. So yes, that also will be there. So that is why they say that the first month is very crucial, because if something is going wrong with them also, they cannot just like scream out, or it's not possible for them. So that is why they say that it's best to avoid making a newborn baby sleep in between parents, because to avoid any accidents, guys. So yeah, that is what is best. And why every 2 hours you have to get up and feed them. That is also good, because you can keep an eye on your child, because first month is very important, very crucial. Anything can go wrong also. So it is best that every 2 hours, if you see, it is good that okay, the child is safe, the child is like is sleeping on, or she is sleeping, and they are good, they are doing all right. And I remember I was so scared that every not 2 hours, every an hour or something, I used to keep an hand on my child, because I was like, is he breathing, I mean is he okay? So I don't know, there won't be much of the movement, so you guys will obviously feel that is everything okay, is the child breathing? So I had a lot of that thing. I mean I just kept my hand on my baby's tummy, just to see if there is a movement and all. I mean yes, that's something like freaks we mothers a lot. So yes guys, I feel waking up every 2 hours is actually best, because we can check out on a child and to see like if everything is good. So apart from that, the first month, what you can expect would be Nothing, the more of a child, like sleeping and like you waking up and feeding them and then burping and all, and there won't be much of the movements. Baby will not even try to move themselves or try to crawl over or something, tummy time and all. But yes, I do remember in the fourth week, if I'm not wrong, I did try to like turn over my baby just for the tummy time, because tummy time is super important, guys. It's very very important. If you don't want the if you don't want baby to suffer with colic, please, tummy time is very important, guys. Please do tummy time. Tummy time is the most important. It will help baby to release the colic, and it will help the baby to be calm. My child, I did tummy time, but still I don't know how he got colic, and he kept on crying constantly, and that was but for the later period. But yes, please don't forget to burp, please don't forget the tummy time and all. So please, guys, this is what you have to see, but please be very careful in the first month, because it's very important. Like I don't know how to explain to you guys like in more detail, because just be careful with the child, with holding the child, and with the way you handle them and all. It's very important. First month they are very delicate, so it has to be handled with care, with more care actually, I would say. And try not to keep giving the babies to other people, and if someone is coming from outdoor, please make sure you guys sanitize and then hold the child. It's very important. Child can fall sick immediately because they are very tiny, and it's better to avoid going out, I would say, because the pollution, the dust and all also can cause them anything. So yes, try not to, but gradually it will change as the next month and all. So yes, you guys can do that. So today you guys might have not seen Jaden in my video. Actually, he's sleeping. You guys can have a look. He needs fan. Without fan he will not sleep, and if I turn on the fan fast you guys will not be able to hear me. That's the reason I kept a small mini fan for him. So yes, guys, that's all for today, and you guys can check out my other videos. It has a lot of it has a lot of details. I've given all the details, and it's all the truth, and there is nothing that what you call, which I've not experienced. The things that I've experienced is what I'm sharing. So please do check out the videos, and do like, share and subscribe, guys. It will help to reach out to other parents as well, or who are planning to become a parent. So please, guys, click on the subscribe button and share your love. Thank you so much for your time. Take care.